Hi, I'm Dr. Jane Yu, board-certified dermatologist and Mohs surgeon. Today I want to talk to you about spicules, a technology coming out of K-beauty that you may be seeing more often and one that's important to understand correctly. Spicules are a physical delivery technology. Unlike systems such as liposomes or exosomes, which work chemically or biologically to protect or signal ingredients, spicules interact with the skin through a mechanical mechanism. Spicules are microscopic, needle-like structures. Traditionally, they are derived from marine sponges, where they are composed of biosilica and form part of the organism's skeletal structure. These structures are microscopic in size, generally in the range of about 100 to 300 micrometers, and were first introduced into cosmetic applications in Germany in the 1960s. When applied to the skin, spicules create thousands of extremely small invisible microchannels on the surface of the skin. This process is controlled and superficial, and most people experience it as a mild tingling or prickly sensation rather than pain. These microchannels can temporarily make it easier for topical ingredients to move through the outermost skin barrier. Early generations of spicules were primarily used for exfoliation of dead skin cells, while newer generations are designed to enhance topical ingredient delivery. This is why spicules are often paired with ingredients like retinoids, peptides, or other actives that may otherwise have limited penetration. At the same time, the mechanical stimulation itself encourages normal skin turnover and repair processes, which over time may help improve skin texture and smoothness. Spicules are often confused with microneedling, but they are not the same thing. Microneedling is a medical or professional procedure that uses needles to puncture the skin and deliberately create micro-injuries in order to stimulate collagen production. Because it involves true skin injury, microneedling requires controlled technique, professional oversight, and often comes with downtime and risk if not performed correctly. Spicules, on the other hand, work very differently. They are much smaller, non-invasive, and remain confined to the superficial layers of the skin. They do not create the same type of controlled injury, do not involve bleeding, and do not require recovery time. Instead, they create temporary microchannels through gentle physical interaction, resulting in mild, controlled stimulation rather than medical injury. Because natural marine spicules often have sharper tips, they can produce a more noticeable tingling or stinging sensation when applied to the skin. This immediate sensory feedback has contributed to their popularity online, where discomfort is sometimes interpreted as a sign that a product is actively working. As spicule technology has evolved, synthetic spicules have been developed. These lab-created spicules allow manufacturers to precisely control size, shape, and consistency, which is important for reproducibility, safety testing, and formulation control. Synthetic spicules are often designed to be blunter and more uniform, reducing discomfort while still allowing effective superficial interaction with the skin. One reason spicules have gained traction so quickly in K-beauty is that they offer a unique combination of physical delivery and gentle stimulation. By enhancing topical absorption without relying on chemical penetration enhancers, spicules represent a different approach to improving ingredient performance. Rather than replacing professional treatments, they are commonly used in Korea as maintenance between in-office procedures. In markets like the United States, where access to professional microneedling may be more limited, spicules are often positioned as a way to achieve a more advanced, high-performance skincare experience at home without the pain, downtime, or risks associated with true needle-based procedures. Spicules are an interesting and evolving technology, but they are not interchangeable with medical treatments. So understanding how they work and how they differ from microneedling is essential for setting realistic expectations and using them appropriately within a skincare routine.